In my 11 years of nursing, I've seen the devastating effects of all kinds of cancer. However, none of these have affected my life like lung cancer has. I learned firsthand the effects of this horrible disease when I lost my grandfather. Cigarette smoking is not only destructive to your body, but also the number one cause of lung cancer. More than 159,000 people die each year, and lung cancer is a leading cause of cancer deaths worldwide. I believe these are the important points you should know about cancer. What is cancer? What are the risk factors for cancer? Signs and symptoms, and also the treatment. I will now explain to you what cancer is. Every day, cells in the bodies grow and divide to form new cells. When normal cells get old and damaged, they die, and new cells take their place. New cells are continuously made, and when the old and damaged cells don't die, this causes a buildup of cell growth, which then causes a tumor. There are benign, which are non-cancerous tumors, and malignant, which are cancerous tumors. Smoking tobacco and secondhand smoke, according to the National Cancer Institute, is the number one cause of lung cancer. That accounts for 90% of all lung cancer cases. You can also get lung cancer from exposure to radon and asbestos. According to the CDC, radon gases cause about 20,000 cases of lung cancer each year, and it's the second leading cause of lung cancer. You can also get lung cancer from radiation therapy. Unfortunately, patients who have went through cancer already then have to go through radiation therapy to their chest are at a higher risk of getting cancer. If you have a family history of it, you have an increased risk in your genes for developing lung cancer. Signs and symptoms of lung cancer are a chronic cough that lasts more than 2 weeks, coughing up blood, shortness of breath, aches and pains in your shoulders, and repeated infections like bronchitis and pneumonia. There are a few ways to treat lung cancer. There's surgery, and there's 3 types of surgery that they can do. A wedge resection, a lobectomy, and a pneumoectomy. There's also chemotherapy and radiation. The chemotherapy is IV medications or pill form that are used to kill the actively dividing cells. Or the radiation is when they use high doses of radiation to kill and stop the spread of cancer. The radiation can be internal or external, and about half of cancer patients have to do this. I know everyone's heard of lung cancer, but I hope I have given you some information that will help you understand it a little better so that maybe you can help someone else. The consequences of smoking far outweigh any perceived benefits. So many people claim that smoking calms them down or relieves stress, or if they quit smoking they will gain weight. Is it really worth being sick, losing your hair due to chemotherapy, or worst case scenario, even death? I wish people would reevaluate their lives and stop smoking. I can say this because I quit after 16 years myself. I watched my grandpa die from this horrible disease, so when my 10-year-old son took my cigarettes and broke them in pieces and begged me to stop, I knew that's when I had to.